If you live with Hashimoto's, an autoimmune disease that affects your thyroid gland, you may have heard of an intriguing experimental treatment, worm therapy. In this video, we'll explore how introducing parasitic worms into the body might help ease your Hashimoto's symptoms. We'll also look at the risks associated with this unconventional approach. First, let's understand Hashimoto's thyroiditis. In this autoimmune disorder, the immune system mistakenly attacks the thyroid, leading to hypothyroidism. Symptoms include fatigue, weight gain, depression, brain fog, and more. Traditional treatments focus on managing these symptoms, typically with daily thyroid hormone replacement medication. Worm therapy, or helminthic therapy, is an experimental treatment that introduces parasitic worms into the body. Surprisingly, research suggests that chronic worm infections might help regulate an overactive immune system, which could benefit people with autoimmune diseases like Hashimoto's. In a worm infection, your immune system initially reacts, but over time, it adapts, releasing fewer inflammatory cells. This reduced immune response can help calm inflammation in the thyroid, potentially easing Hashimoto's symptoms. Studies on worm therapy, particularly in cases of inflammatory bowel disease, suggest it may offer benefits. Studies indicate that, over time, worms may regulate and balance the immune system. This new balance reduces your immune response to perceived threats, which may lessen Hashimoto's symptoms. Worms may help suppress inflammation. In turn, thyroid inflammation may decrease. And less inflammation can reduce destructive thyroid antibodies, as well as Hashimoto's symptoms and flare-ups. A diverse gut has a protective layer lining the inside. This layer helps prevent toxins from entering your body. But, in those with an autoimmune disorder, that layer is leaky. Worm therapy may alter the makeup of the gut microbiome and help restore or repair the protective layer. Some people have reported improvements in autoimmune symptoms after undergoing worm therapy. Some may even argue that worm therapy is better than other therapy for autoimmune disorders. But, results vary from person to person, and there is still much unknown about worm therapy. Medication costs can add up. Some argue that worm therapy is less costly than traditional medications for managing autoimmune disorders. Despite its potential, worm therapy comes with risks. Worm therapy is experimental and not currently approved by the Food and Drug Administration, the FDA, as a treatment for Hashimoto's or any autoimmune disorder. Introducing live parasitic worms to your body increases the risk of a parasitic infection. Side effects may include itching, fever, diarrhea, and intestinal damage. Many people are understandably uneasy about receiving and ingesting live eggs or larvae. Unfortunately, worm therapy isn't a one-and-done type of treatment. You'll most likely need to consume live eggs or larvae on more than one occasion to see benefits. For example, one study had participants ingest 2,500 live eggs every 2 weeks for 6 total doses. There are many types of parasitic worms. Since the treatment is still experimental for autoimmune disease in general, we're still waiting for clear guidelines on which type of worm therapy would work best for your health condition. While worm therapy shows promise, it's still an experimental treatment with significant risks. Before considering it, consult a healthcare provider familiar with both traditional and integrative therapies for Hashimoto's. If worm therapy isn't right for you, there are other integrative approaches available to help resolve your Hashimoto's thyroiditis. Paloma Health's thyroid experts can guide you toward a treatment plan that's right for you. This video has been brought to you by Paloma Health, the nation's leading medical practice dedicated to hypothyroidism care. Learn more at www.palomahealth.com.